I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio, sponsored by Gilbert Hospital and Florence Hospital at Anthem. Joe, how are you today?
I'm doing great. How are you, Dr. Borik?
Good, good. You know, when we started this show back in January, remember we talked about DocTalk Radio being a show that really reaches out to the community to provide information about preserving our health and well-being, and not really about healthcare reform or any of that. But I got to tell you, we have a guest today that I'm ecstatic to have. When we deliver health care, when we take care of our patients at the hospital, when we want to maintain and preserve health within our own families and in our own lives, we can't separate that necessarily from what's happening, at the healthcare level. And so today we have a very, very special guest. On the phone we have Arizona State Senator Nancy Barto, and Chairperson for the Senate Health Care and Medical Liability Reform Committee. So, Senator, are you on the phone there?
I am. Thank you.
Thank you so much for being here. I want to personally thank you for taking the time to join us on DocTalk Radio today.
Thanks for having me on the program.
You're welcome. Why don't you just tell us a little bit about yourself?
Well, first, my husband, Joe, and I, we've lived in the Valley since we were both, very young. And we have 3 grown daughters, son-in-law, 2 adorable grandchildren. I was appointed to the House in 2006, after there was a vacancy in office in my district, which is currently Legislative District 15. Covers basically northeast and a lot of northwest Phoenix and Scottsdale.
Okay.
I've served 3 terms in the House, mainly focusing on family, foster care and health care issues, and now I'm running for my 2nd term in the state Senate, where I chair the Senate Health Committee, as you said.
Wow. Congratulations. That's great.
And this time I don't have any opposition, which makes this campaign season a lot better than my previous ones.
Very nice. That's great. I'm not really that well versed in when it comes to healthcare reform and Obamacare and all of that kind of stuff. But I would love an opportunity to ask you to bring some clarity around, the chaos and confusion that sits in all of that discussion. What is Obamacare? Can you help shed some light on what it is and really what are the choices that we as Americans and Arizonians are facing as it relates to Obamacare?
Sure. As a lot of people realize, Obamacare will, and frankly, it already has, presented a sea change in health care, where government is taking another exponential leap in regulating both health care providers and insurers, and they're attempting to define the proper amount of insurance the government believes is best for every American and impose it on us. And they will do that, of course, by mandating most of us purchase a high level of insurance or pay a tax. And the law also expands the role of the Medicaid safety net beyond what the federal government and beyond what most states can afford. In light of the law, people are really concerned about 2 main things. I think first, will they be able to continue to afford health care in the future? And by health care, I guess I should qualify that I mean health insurance. Right now, they're facing premiums rising 7.5% to 9.5% each year, and that's despite 0 inflation, and that's before the costly provisions of the Affordable Care Act actually kick in 2014.
Wow.
And the other fear people have is that they'll lose control of their health care decisions. They've read the same tea leaves that the CBO, the Congressional Budget Office, is reporting, that the big entitlement systems are causing economic instability. They know that 42 cents of every dollar spent in Washington is borrowed, and they're concerned. So, with all of the new regulations, the 159 new boards and commissions so far, and 13,000 pages of new regulations, and the cost going up to $2.6 trillion now over 10 years, and the new taxes, they're afraid that in order to make the numbers work, they're going to lose control of their health care decisions, and they're right. And from a state government perspective, we really face similar challenges. We've got to decipher whether Arizona can afford to grow our Medicaid program, which is already almost 30% of our budget. And we've got to responsibly answer the question of whether we as states should morally continue to add to the problem of entitlement overspending or move to reforming these systems. So, we really need, we have a lot of choices as a result of this law being imposed and facing these choices before us.
So, in your opinion, how do we address the high cost of health care, insurance and health care? I mean, what's the recipe in your mind to fix this?
Well, first of all, we've got to make the decision to fight what is really going to be detrimental to our citizens, and that is to not implement the law, a harmful law that's going to harm businesses. It's already very much put in jeopardy our economy, slowed it to the point where we're just practically not growing at all. And we can do that by making a decision not to implement a state exchange. That's besides expanding whether or not to expand Medicaid. That's another looming decision before us. But in order to really address the real issues, I mean, this isn't a question of whether or not we need health care reform. We do. Right. But to control costs, health care needs a good dose of competition. We need price transparency and patient responsibility. My neighbor's going to get tired of paying for health care for someone who smokes, drinks a six-pack after work every night, and never exercises. Right. We see plenty of ads competing for our attention on television for things like corrective eye surgery, like LASIK, and all kinds of cosmetic surgery and chiropractic, because, they all have one thing in common. A third-party payer is probably not involved. So consumers are shopping around and making a choice. This isn't an advertisement for doing away with insurance, but exactly, it's obvious that insurance is keeping people from understanding the market forces in healthcare to the point where we no longer have a healthcare market. It needs to be reawakened. People treat health insurance like no other type of insurance. Right. Something that they hope that they won't need to use. They use it for every type of health need. So first, we need a lot more transparency in healthcare to move in this direction, both to compare healthcare quality and cost. We had a health transparency bill this past session that would have cracked that door open just a little bit, but it was really fought hard by the status quo. And they claimed that patients just wouldn't know how to deal with the information. It's really laughable. The healthcare industry so underestimates healthcare consumers, but we'll keep at that and many other efforts next session, I'm sure.
So how do we deal with the uninsurables? With the people that have pre-existing conditions and so forth. As a physician, a hospitalist, we don't turn anybody down. We see patients every day, day and night, 24/7, and never turn anybody down for treatment. So I'm kind of confused about that, but that may be another discussion. But how do we deal with the uninsurables and the pre-existing conditions?
Absolutely. Well, covering the uninsured is what gets most of the attention in this discussion, and for good reason, and especially those who cannot get insurance at all, even for a price. But there are ways to handle that. It's a relatively small population, so without throwing the entire healthcare system under the bus, by mandating everyone purchase a high-benefit insurance policy through exchanges or by overburdening the safety net, we've got to deal with that. I don't believe that this issue can be resolved completely free of government intervention, as some do. I think we have to take incremental steps to move to a more free market But government will need to continue to be involved for a while, and maybe forever. But some high-risk pool programs are working really well in other states. They just have to be very well run and well funded. And frankly, Arizona's semi-attempt at that wasn't on either count. And neither was the federal risk pool in place now until that will continue to be in place until the ACA takes effect. It's woefully underfunded, and its premiums are way too high for most people to afford. We could also go about meeting the needs of the uninsured relatively inexpensively through premium supports at the federal level. Republicans only have themselves to blame for, placing this important issue on the back burner for so long until we were and are forced to really come together to solve it. But now I think there is a will to address all the issues of high health insurance costs.
Right. What do you mean by premium support? What does that mean?
Well, it means either through a tax credit where every American, and this could be about a $17 billion cost, where in comparison to a $2.7 trillion cost, it seems like a drop in the bucket. But it would basically allow Americans to have a base level of premium support towards insurance. And then depending on their income level, it could rise or fall. So if the uninsured presents at an emergency room, they could claim that credit for their care, and then use it for the purchase of health insurance. That's one way of solving the issue, or one solution.
Mm-hmm. Very good. I want to open up the lines. Joe, why don't we? I don't know if there's any callers in or anybody yet, but certainly people out there listening, we welcome any call-ins if you have any questions as it pertains to the topic today that we're talking. We have Arizona State Senator Nancy Barto on the show, and so it's a great opportunity to dialogue and join in to the conversation. The phone number, Joe, is 480-754-1033.
Very close, Dr. Borik.
745.
That's right. 480-745-1033 for all your comments and questions.
Very good. Very good. Let's just get back, Senator. I know that true charity. I mean, when we talk about charity care, if we're talking about uninsurables and so forth, how does that come into play in this conversation?
Well, we have a lot of charity or nonprofit hospitals and health plans, health facilities that call themselves nonprofit, and it connotes something that it's not. We used to have a true charity system where hospitals provided health care for free, and they didn't get government funding. Things have changed dramatically so that now, all hospitals basically receive government funding. So we've gotten away from a truly private type of charity to the poor. There are ways, I think, there are some laws that need to be reevaluated on this score so that we reward people that really want to serve the poor.
Wouldn't that be awesome?
Benefiting.
That would be great. And right now,
there are a lot. There are some really great health facilities, privately run, mostly faith-based, in the Valley that are doing a great job of serving excellent health care to the poor. And, they may charge a $20 copay simply because it gives the patient some modicum of respect.
Exactly.
So that they feel like they are grateful and thankful for that care.
Mm-hmm. Yeah, that's really, really important, I think, to get back to the basics, of that, of respecting each individual, respecting life. I mean, there's just a lot to talk about when it comes to that.
Yes. We also, last session, on sort of a peripheral way, we tried to encourage missions that want to come to Arizona, such as RAM, where they go across a remote area medical, where they go generally, in the past, they've gone across the seas to minister and provide health care to people like in Uganda or other underserved areas. Now they're finding underserved areas within the states, and they want to come to, maybe our reservation or one of our reservations in Arizona, but the licensing restrictions have been preventing that from happening easily. So we tried to run a bill that would make it easier for that type of health care to be delivered. That too was thwarted, but we will keep at that because I think it's important that all kinds of health care are delivered through whatever means possible to meet people's needs, and it shouldn't always have to have a government source.
Boy, that's great. Joe, do we have any questions or comments yet? Anybody up?
No, not right now.
Okay, good. Senator, how did you get interested in healthcare? I mean, just a little bit more just about your own personal story. Is there anything that you want to share that really kind of directed you to being interested in this? Well,
what really showed me that one person can make a difference was, about 19 years ago, I realized that that could happen because there were issues in our own city, in the city of Phoenix, where there was a bubble ordinance imposed upon people for standing in front of an abortion clinic to talk to women entering and giving them information about alternatives to abortion. And we were thwarted by a bubble ordinance put into place by the city.
Wow.
And it restricted our ability to even walk on a public sidewalk in front of certain healthcare facilities. And I had an opportunity to be a plaintiff in a lawsuit challenging that because it thwarted our very right to free speech. And we took that all the way to the Supreme Court and won.
Wow.
And it just showed me that, a mom that raised kids and cares about what's happening in our community can make a difference. And it really showed me that there's more to do, that people are needing leaders. Mm-hmm. And so, one thing led to another in my specific case as far as being involved in writing letters to my legislators and helping on campaigns. But it's just been very rewarding to be able to be a voice for people like me. I know there's many that feel the same way, that their voice just isn't being heard, that their values aren't being represented.
That's awesome. I mean, it really lends to the authenticity of who you are and what you stand for. And boy, that's fantastic. We have a question.
I spoke too soon. I just looked up at the chat. We've got a bunch of questions. Okay. Let me start with the first couple, then we'll kind of take them here and there. First question here is to the senator. Senator, did you hear about the E. coli outbreak in our town of Santan Valley? I live in Johnson Ranch, and I'm really frightened for my kids at home and school.
Wow, I really had not heard.
There's a lot going on with the E. coli outbreak out here, and
do they know the cause? Do you know anything about that, Dr. Borik?
I don't either, and that's what that's what we need to kind of figure out. I can tell our listeners out there that E. coli is a bacteria, and people that are most susceptible to it are people that are immunocompromised, meaning diabetics, people whose immune system is suppressed. If you're on steroids or if you're on medications, for example, if you have a liver transplant or a kidney transplant or something, your immune system is going to be very, very down, and your chance of getting sick because of the E. coli is higher. However, that doesn't say that the general healthy population is not at risk as well. So it's very, very important to be aware, not to ingest any water if people are telling you in your area that there's an infected water source, to avoid that. But honestly, I don't know a whole lot about it. I haven't heard either, so I'm not sure where we're at.
Senator Barto, what happened was Johnson Utilities is the water supplier for most of Santan Valley. Well, when I say most, I'm guessing there's 83,000 people, I believe, in Santan Valley, but a great amount of it. and they have done 2 tests, independent tests, and they have found E. coli, and now they have put out massive alerts to the schools, to the restaurants, everybody in this area not to drink the water because of the E. coli. And I do believe, from a source, so I can't say it's 100%, but I was told that there are many hospitalized at this point, and Post and Butte's been greatly affected, our school there in Florence.
I mean, we're talking, this is real time. This is a news flash.
This is right now going on.
Yeah, like right now. So those of you listening that are in this area, stay tuned. I'm sure that the news will have some coverage and so forth. So thanks for that question on the chat.
And then let me just throw one more out there, and then we'll take a break from the questions and go back to your conversation there. Where does Obamacare stand on the malpractice issues that play a part of the current healthcare landscape?
Well, from all that I've heard, Obamacare does not address the issue. It leaves no protection for the physicians that are going to first be under a lot more stress as they deliver care to more people. And, as we can expect under the law, about a third, or I think it might be as close to 46% have said, physicians have said that they're going to stop practicing if the law, goes forward. So in an environment where there's fewer health professionals actually delivering care, the stress of delivering that without the tort protection is really unacceptable. And repealing the law is the first step in rectifying that. Mm-hmm. There was a reason why that was left out, because in order to get the bill passed, they needed support from all different types of constituencies. The answer is to start again. Let's leave this so-called Affordable Care Act lying in the dust, and let's do...
I can't hear.
Did we lose the senator?
I think we may have. I'm not sure.
Senator? Oh, her call just dropped. That was strange.
Did it? Okay. Well, maybe we can reconnect.
Let me see.
Okay.
We'll check here. Senator, are you with us? Senator?
Okay.
Hello?
While Joe is doing that, I'm just going to kind of...
Yeah, she must be on a cell phone. It just dropped,
okay.
so
well,
we'll get right back. Right, I'm sure she'll call right back.
Okay, good. You have it there?
It's Joe.
Let's see if we have her.
She's having a cell phone issue, I think.
Okay. Well, until we get there, just for our listeners, let's continue the conversation. My comment to what the senator was just talking about was colleagues that I know in practice right now that have outpatient practices today are actually planning to leave their practices and close their practices as an outpatient physician, which really kind of lends, it's a problem. As a hospitalist, I'm trained to take care of patients in the hospital, but honestly, in order to preserve health and wellness, we got to have good outpatient physicians. And if we don't have those physicians on the outpatient side, then I think that preventative care is going to suffer. I think that there's going to be a delay in diagnosing and treating different, medical problems and so forth. So I think it's a real problem, and it's more than what I think is on the surface. When you delve down into, really what's happening at the level of the physicians treating their patient, one patient at a time, that can be a real problem. And so that's just something that personally that I've kind of experienced. Well, for those of you listening, if you have any questions or if you want to chat and call in, we can talk a little bit more about just general topics. I want to get back to the E. coli issue. Usually when people are infected by E. coli causes diarrhea. That's probably the first and the biggest problem that E. coli is. And what happens is in the lining of the gut, this bacteria overgrows. It causes massive profuse diarrhea. And what happens is we become dehydrated, and people really are at risk of losing lots of fluids, losing lots of electrolytes very quickly. So if you feel nauseated, if you feel gurgling in the stomach, if you feel diarrhea, even some vomiting, if it gets to the point of nausea and vomiting, unable to keep anything down, that's the time that you want to get in to see your doctor, get into the ER to get some IV fluids, especially in people who are diabetic. Because if you're taking your medications, if you're on insulin or your diabetic medications, and on top of that you get this E. coli infection in your system, within 4 to 8 hours, it can move very, very quickly, and things can change, and you can become dehydrated rather quickly. So please be cautious of that. Those of you that are diabetic, for example, and you do get an infection, the recommendation is if you're not eating normal amounts of food, in order to prevent your sugar from dropping too quickly, cut the insulin dose in half, call your doctor, get some instruction on what to do, because it can be a problem. What happens with E. coli is that there are certain toxins that are released from the bacteria, and those toxins can be very dangerous to the body, and you can go into what's called sepsis. You can become septic, and when that happens, it could affect just about every part of the body. It could affect the kidneys. It could affect the liver. So this is a real deal kind of a thing. Now, there are different subsets of E. coli, and honestly, I don't know what the subset is. There was an outbreak years ago with meat, and people who get sick with E. coli after eating, hamburger meat, for example. It's the O157 strain. That can be very toxic and deadly. At this point, I don't know what E. coli strain has been identified in the Johnson Ranch water supply. So just kind of be aware of that. I think keep a panic, anxiety level low. Try to keep calm with it. But please make sure that you're hydrated. I think that's the biggest thing. And we're right here, the Florence Hospital at Anthem. If there's any questions or, certainly the ER, we're available for anybody to come in.
And all I can ask is those of you that we've got so many lines ringing right now, the senator's not being able to get back through. So if you guys could please, whoever's calling in, just hang tight for a second. Let's get the senator back on the line. That would really be awesome. And then we'll take your call-ins. And, the chat is open as well. You can jump on the chat there. But our lines are they're just flooded right now. And there's 32 lines going. So
Wow.
So please just hold them on a minute. We'll get the senator right back on for you.
So the message is, if you're calling, please hang up so that we can get Senator Barto back on the line. Joe, what a great person, an opportunity to have on the line. Let me just see. I think this might be the senator calling. Hold on 1 second. Hello? Yes. Yeah, do you want to try back on the line?
We just asked people to stop,
Yeah, they're calling. We just tried to ask them to hang up, so we're going to try to open the lines, and if you can call in, that would be great. Thank you. That's okay, thanks. Okay, thanks. Bye-bye. Okay, well, this is live televised radio, so this is pretty cool, actually. The senator's going to call back, so again, if you're trying to call, please hang up to open the line so that we can get our guest back on the line. But as I was saying, Joe, what a great person. This is an opportunity for us to have the senator on the phone talking about health care reform, really trying to bring some clarity to really the chaos that is there, because certainly I don't understand a whole lot about what's going on with it. Until we get her back on, I want to go back to talking about causes of diarrhea, because I think this is just a good time to talk about that. There are certain bacteria that cause diarrhea, E. coli being one of them, but I got to tell you, there's many other causes. There's viruses that can cause diarrhea. There's different bacteria, Salmonella, Shigella, Yersinia, Campylobacter, E. coli being one of them. So I think the biggest message is to protect the body and prevent dehydration is the biggest thing. Any other questions that people can come in and chat on, we can certainly talk about. I just want to kind of share with you a couple cases of some patients that I've had recently. There's something called nephrotic syndrome. And what happens is, without really knowing, without having a history of kidney problems, a lot of times, not a lot of times, but some people can experience this nephrotic syndrome by clinically experiencing swelling. Legs swell, hands swell, like increased amounts of weight gain in a very short period of time. And what happens is, at the level of the kidney, the filtration process is affected. And we end up urinating out and losing more protein than we're supposed to. Usually at the level of the kidney, there's a filtration mechanism that's in place in the normal kidney. We hold on to protein. And protein in the vasculature tends to hold on to fluid. And so, if you're low in protein, for example, if you're losing protein, what happens is we end up what's called third spacing, meaning that fluid tends to seep out into the third spacing and you get puffy. Your hands, your rings get puffy, your legs swell up, even the scrotal area gets inflamed and swollen. And it can be a real problem. What happens is that whether it be a virus, whether it be an infection, E. coli sometimes can be one of the causes that can cause a problem at the level of the kidney. And that is something that people need to be aware of. So if you find that you have this excess swelling that just doesn't go down, weight gain, sometimes it can be at the level of the filtration mechanism of the kidney, and it's called a nephrotic syndrome. When you look at the kidney structurally, the kidney looks normal. On ultrasound, completely normal. You do the blood test, and even the creatinine, which measures the kidney function, is normal. But what happens is you end up spilling a lot of protein in the urine. And what we do for that is find out what the cause of it is. A biopsy of the kidney oftentimes is needed. But we can trace it back to some inciting event, whether it be an infection or something, an autoimmune process. So that's just something to kind of be aware of if people are experiencing any kind of swelling that's untoward. Thyroid is another thing that causes swelling. So that's just something else to kind of keep in mind. Joe, how are we doing with our phones? Any?
I just cleared them again. They were still 100% used.
Okay.
100% lit up.
Okay.
I think we should have just said we'd call her, but.
Okay. Well, I have her number if you want to try to get her on the phone.
Sure.
Okay. Let's see if we can get the senator back here.
This is the first time we've ever had this problem.
That's okay. This is a unique show, and
I went from 22 lines to 33, thinking we'd never filled 10 of them, but.
Here, I'm not going to read it, but you can just look at that, and why don't we try to get the senator back on the phone? Just in kind of recapping some of the things that we're talking about in terms of affordable health care. As I was preparing for the show, I checked out the senator's website and did a little homework, and some of the notes that I made that really made sense to me. When you talk about coming up with a recipe to make affordable health care, this is kind of what I jotted down. Curbing some of the malpractice lawsuits to provide better climate for physicians to practice. As we get busier, there's still only 24 hours in a day. As we get busier, seeing more patients, seeing more critically ill patients. Here you go. Why don't you answer that? I pushed it already. There's room for mistakes. And, we've got to be careful that we don't knee-jerk and just practice defensive-type medicine, because I think that can be a dangerous thing. We want to make sure that, within the restraints of where we're practicing, we want to be able to give the best health care and the best treatment to the patient that we're ministering to. The second thing was minimizing third-party payers and returning the financial power to the consumer by building on health savings accounts. I think that the Senator Barto had alluded to that earlier. Health insurance should not be dependent upon a job or loss of a job or when your job changes. And I think that's important. For example, there should be some stability around health care and health insurance. Transparent prices I'm not sure really what that means, and I know that the senator had talked about that, but we need to know what healthcare costs. And honestly, I can't tell you that I know what healthcare costs, and I'm not sure that, if you're listening, that you can answer that question. And that's a question that I think we need to answer. Uninsurables, I think that was something that needs to be in the mix when we talk about providing health care that is affordable for our patients. So I think those are some of the things in recap that needs to be addressed in terms of health care and making health care affordable. As a practicing physician, I got to tell you that we never learn anything about this in medical school. We go to medical school, we do our whole pre-med, we get into medical school, which is a challenge, and then the entire time we're taught and trained on how to manage. First of all, we need to learn what normal is as it pertains to the physiology of the body. Once we know what normal is, then the entire time in medical school and training and postgraduate training is really directed toward how to identify abnormal and then how to treat it. How do you identify a heart attack and then how do you treat it? And you can name that. How do you, find where are we at? How do we,
Get me back her number on there.
Okay. How do we identify a breast mass, make the diagnosis, and then how do you treat it? And I think that's really what the physician is trained to do. Nowhere in medical school curriculum are we ever taught on what healthcare reform is, what healthcare insurance is, how does it pertain to our day-to-day practice. And so really the people who are in the dark in my practice and in my day-to-day are the physicians. And I got to tell you, I can sit in the physician lounge and we're talking, and the conversation is more about, a good case, how we save somebody from dying or kidney failure or whatever. But we really don't know a whole lot about the healthcare reform, and I think we need to start opening our eyes and learning more about that. Senator, are you there? Are we there?
Senator, do we have you back on with us?
I think I can hear her talk.
Senator, can we hear you?
We can put a speaker. We can make it.
How do we do that?
Here, I'll show you.
Wow, this is crazy, isn't it?
Are you there?
I'm here.
Oh, good. Very good. Okay. Are you there?
Yes, I'm here.
Okay, good. While you were away, I was just talking about how physicians are not trained. We really are clueless when it comes to healthcare reform, what it is, and all these terms that you're talking about. And really it brings us to something that is new to most of us, fairly new, and that's electronic medical records. Can you speak to that a little bit?
I'm really having a difficult time hearing you, Dr. Borik.
Okay.
Were you asking about the medical malpractice issue?
Actually, I'm asking about the electronic medical records.
Oh, okay. All right. Because I think we were kind of cut off in the middle of my diatribe on
Okay.
on medical malpractice, but I'm not sure if I got to finish my thought. Yes, it's been a really interesting journey learning.
Is she not there?
I don't believe
On and they will be a big problem solver. Now, don't get me wrong. I don't think that they won't help once they're implemented and used appropriately. But they can bring in a whole other set of issues that I think consumers and physicians, insurers, all of us need to.
Okay. Yep, I think we lost her. That's okay. Well, let's just kind of continue the show, and we'll kind of keep moving. Electronic medical records, which is what she was talking about, bringing a whole set of issues. And from my understanding, this is something that is implemented, that is required. Our hospital, you know that I'm with Gilbert Hospital and Florence Hospital at Anthem. Mandatorily, we just went to a complete electronic medical record system. And it does bring a whole set of, a whole new skill set, in terms of managing our patients, but not having a chart to look at. everything is electronic. So it's a huge new set of skill set. But what I'm concerned about, which is I think what Senator Barto was going to allude to and get to, is how do we keep it confidential? Is there a confidentiality issue with electronic medical records? Because remember now, all of your medical information is somewhere in the airwave. I mean, it's electronic now. And it's web-based. And so, how I access it is, just like every other hospital in the country accesses it now, and that is via the computer. And so, is that a problem? I don't know. But this is something that is being mandated and being brought and holding us hostage to, and I think that might be a problem. Anyway, so that's kind of where we are from that standpoint. Well, let's open up the phones, and let's open it up. If anybody wants to talk, let's spend we have about 15, 20 minutes left to talk about healthcare or just my interest, which is wellness and how do we, preserve health and well-being. So let's do that. Joe, where are we at? Do we have anybody calling in? Why don't we take some calls there?
I don't know if our phone system blew up or what happened here. I'm
Really?
telling you, yeah, I'm
Okay.
working on it.
Okay. All right, that's fine. Dehydration, which is what I said is probably the biggest problem as it relates to E. coli, infection, diarrhea. What is it? How do you know if you're dehydrated? Some of the signs and symptoms to look for. If your mouth is dry, certainly that's a sign of dehydration. Take note of, when in the summertime, when you urinate, a lot of times be aware of the color of the urine. If it gets real dark, that means that the body's dehydrated. Take note of the amount of urine, for example. When you have decreased urine output, that means that the body doesn't have excess fluid to excrete. It's holding on, it's trying to hold on to fluid. Those are some of the signs that may tip you off to whether or not you're dehydrated. Check your pulse. If your heart rate goes up, and we want to keep in mind that a normal heart rate is between 60 and 80. If your heart rate is higher than 85 or 90 or is higher than your normal, then that may mean that your heart is trying to pump harder because there's not enough fluid in the vasculature, and that's one of the signs of dehydration. If you feel dizzy or lightheaded, that can mean being dehydrated as well. If you go from a lying position to a standing position and you get lightheaded, you feel kind of woozy, that means that one of the things that can mean is that you're dehydrated. There's not enough fluid in your system. Replacement fluid is really important, especially now here with the question local of this little problem going on in the water system out here in the Santan Valley. Be aware of hydration. Probably the best thing would be the smart water. It has electrolytes in it, along with just regular bottled water would be safe. But take note, remember that coffee is made with water, iced tea, those things. If you get them from a public source, you've got to be very, very careful. Because, if your water in your home is affected, probably down the street at the corner store, if they make coffee, their water supply is going to be affected as well. So, please take note of that, be careful of that. So those are just some of the things to be aware of. Boiling it, I don't know that that's an answer. So, if you think, well, if you're going to boil the water, I wouldn't take that risk because honestly, I don't know what the burden of the amount of bacteria is, and it may require more than just the simple boiling mechanism that you have access to in your own home. So that's kind of something to be aware of. Any other questions? I want to kind of open it up. This is kind of a strange situation, but unfortunately with some of the cell phones, and I know that the weather outside, we had a little storm coming in, so maybe for whatever reason we lost the cell line, or so that's kind of unfortunate.
Yeah, I just can't get through to her.
Okay, that's fine. We can just kind of move on and again open it up to anybody that is interested. One of the things that we're going to be doing that I would like to extend this. Not necessarily the DocTalk show, but I want to talk at some point in the future about how spirituality affects health. because I think there's a lot to be said about that. And so, in the future, those of you that are listening, we're going to be, probably have another separate 30-minute time slot, because I think it's very important. As a physician, we take care of the physical body. And I can tell you, being in practice for 15 plus years, that every time I manage a patient in the hospital, I'm not only managing their physical body. There's a lot more to it. There's the psychological effects that come with it. A lot of people have different spiritual needs that need to be addressed. And when somebody is critically ill, diagnosed with cancer or septic or sickness, one of the things that we find as human beings is that we need to be able to experience not only being ministered to from a physical standpoint, but spiritually as well. And I think that's very, very important. And I think more and more medical physicians, are aligning with that and recognizing that in order to really take care of our patient, we need to get to that point as well. Anxiety is huge. We see a lot of stress. We see a lot of anxiety. We have an upcoming series with a psychologist that's going to be on DocTalk Radio that will be talking about, anxiety disorders, depression, stress, how to treat it. So that's going to be upcoming in a couple weeks.
Well, the phones are working, so we must be just having a network problem on that side. Ralph from Santan Valley. I'm experiencing stomach cramps and diarrhea. Mm-hmm. I had soda last night at a restaurant here in Santan Valley. Okay. So I think since you just mentioned the soda thing.
Yeah, if
that has ice and it's made with water, right?
Exactly. And that's where, if it's a soda from a bottle, that you saw that it was a cap that you had to either unopen yourself, I think you're safe. But if you got it from a soda machine, then there's the potential for that to be contaminated. And bacteria, it's interesting because bacteria likes to reside in warm, stagnant places. And so in a machine like that, there's tubing, so there may be a risk for you being infected. So if you do feel symptoms, I certainly would, listen to your body and, get in to see your doctor. E. coli is a bacteria. And the reason that I say that is viruses oftentimes are self-limiting. A lot of times you don't need to take an antibiotic. If you have a viral infection, we just say, stay hydrated, get rest, and it'll pass. Bacteria oftentimes need an antibiotic to treat. And so with E. coli, you may need to get an antibiotic from your doc.
Interesting here. Becky in Santan Valley said, what are we really going to do? Because how many of these restaurants and places are really going to clean all their ice out? This could be going on for till the ice is gone, and
it could be an epidemic. It is an epidemic. Coming over here just
wow. These are things you don't think about.
It is. I always stop. There's a Starbucks on the corner when I come over here, and it's closed. So there's a lot of restaurants that are.
It is?
It's closed. Absolutely. That's why I got here so early today.
The RO filters work, and that's one of those things. When you think about your RO filter, how many of you really diligently change your filters every 3 months?
Yeah,
and if you have an RO filter, that doesn't necessarily mean it's working. It means you've got a filter. But if you don't change those filters on time, it isn't worth anything.
Right. The question that I have is how, where geographically, what region does this water supply serve?
It's a big area.
Does it extend to Mesa, Gilbert, Chandler?
I think it goes all the way. Now I think here.
Mm-hmm. This is the senator again. You want to answer that? So that's the question. If anybody out there knows, I would love for you to call in and give us that information. Because, if we don't get that answer, I'm going to certainly try to get it and post it on our DocTalk website today to see what the geographical boundary is for this water supply. Because that would be, I think that would be really pertinent to what we're talking about. Anyway, so, thank you for having patience with the show. We've had some problems with the senator staying on the line. So why don't we move on? We'll move on. I think there's a call coming.
Why don't we do this? We'll definitely, we've been looking forward to the show. We'll definitely get you rescheduled on here.
Those of you interested in really learning more about Senator Nancy Barto, you can go to her website. there's some really great information, and it really gives you a little insight as to what a phenomenal person she really is. And it's, if you just Google or just go to Nancy Barto, that would be a great way to get a little more information from her to get to just complete it.
She's having a cell phone problem on her end.
Okay, yeah.
So I was scared. I'm thinking, I think maybe our stuff all blew up. But at least another couple of calls came in there to give me hope. Right. So we can take some more calls here and concerns. Well, we've got some stuff up on here. Okay. Estelle, Dr. Borik, what is the response time for E. coli? Is it instant?
No, it's not. Actually, it depends on the strain again. Sometimes it takes up to 7 days for a bacteria.
Does it really?
There are certain strains of bacteria that within 6 to 8 hours that we see in people that eat like Chinese food that has a certain bacteria in it.
Right.
But for E. coli, 48 hours up to 5 days. Now I'm not an infection disease specialist, so I'm sure they can tell you exactly, the onset and timing of it. But if it doesn't, in other words, if you don't feel sick immediately, that doesn't mean anything because it takes time for the bacteria to get into the system. So, up to a week is really what I would look at. So when I get a history from a patient, I'll ask them, up to 2 weeks or 3 weeks of travel history, if they've, been traveling to another country, if they've ingested water that possibly can be affected, up to, 21 days, it could affect the body.
Now, I don't know if this is a joke or if this is somebody just being funny, but Charles from Pinal County said the CDC and the military are on the way to contain this. I mean, why would the military be involved in that? This isn't the movie Outbreak, I hope.
I don't know. I mean, that may be a semantic
that's what I'm thinking.
But I think the message is that this is an outbreak and that there's some response that needs to be addressed.
So don't take that as the gospel, what I just said. Right. We have that was an absolute unconfirmed source. We have no idea who that was. So.
Okay. I think right now, from a medical perspective, the things that I would want to do would be to identify the geographic boundaries so that we know whether or not we're in that area, be aware of what potentially can be the symptoms, and absolutely avoid drinking any tap water.
If anybody can tell us the boundaries, please call in. We'd like to know what they are. Yeah, for sure.
Yeah, but ice, things that you don't think about: coffee, iced tea, ice is made with the water. So, even if, let's say you go grab a Diet Coke and it's in a can, but then you get a cup of ice, be careful.
What about brushing your teeth?
Any water that you use, you have to be careful of. So at this point, I would go strictly to bottled water. And, even as you said, brushing your teeth. The question that I have is showering, bathing. Is there a potential to get infected, this bacteria through the pores of the body? As far as I know, the answer is no. However, again, I'm not an infection specialist, and that's something that I need to get an answer to, because if this is truly an outbreak, I would be careful of showering in the water that would be contaminated with E. coli, just for fear that you may get some water into the body. So I would be very cautious of that. Fever, chills, usually those are the first things that we see. So if you feel chilled, you feel feverish, you have nausea, those are some of the symptoms. And as I said, it can happen up to 14, 21 days out. The initial onset could be as soon as 48 hours. Usually you don't see it sooner than that. Unless it's a different strain that the onset is within 8 hours or 12 hours, which I don't think it is. But we'll try to get a little bit more information, from that standpoint. I think the big thing is people who are immunocompromised. If you're on steroids, if you're on prednisone, those kinds of things. Diabetics, be careful.
Now, again, I just have to give this disclaimer.
Okay.
We don't know Melissa from Pinal County, but she called in and told us the boundaries.
Oh, good.
And she said the boundaries are all the way to Florence, to Anthem, past Ocotillo by Banner Hospital, all of Chandler Heights, except for people that have wells. Of course, all of Johnson Ranch community and their surrounding areas. And there's 2 strains of E. coli that have been found.
Okay, but they didn't know. They didn't tell us the strain.
Did not tell us the strains.
There's a strain 0157, which is a.
And thank you, Melissa from Pinal County, for calling in.
Very, very good. That's good information. Good.
Wow. That sounds like a... And remember, guys, we've got Florence Hospital at Anthem, and that is right there at Anthem. When you drive down Hunt Highway, it's right on your left. If you need to go to a hospital, go to the hospital. We don't even know how busy they are right now.
Right.
And then you've got the Gilbert Hospital. There are other hospitals as well.
Yeah, don't hesitate. When it comes to something like this, if you feel ill, there are different things that we can do to check to see if you're infected.
If somebody is infected and they think, maybe I just have the flu, does this progress into death? I mean, does this get that bad?
There are certain strains that do, and that's why I ask. There's a strain, as I said earlier, the E. coli 0157, which usually is found in more hamburger meat. It's just affiliated with that. It can cause very quick decline in the body. It affects the entire cascade of coagulation. People become septic. Bleeding occurs.
What does septic mean?
Septic means that there's factors in the body that are released that, in response to an infection, that cause low blood pressure, decreased flow to the kidneys. People end up going into organ failure.
Wow.
Because of it. So, and that can happen pretty quickly. Now, I'm not saying that that's related to
Right.
There's a strain that we see. If you have bloody diarrhea, I would definitely get checked.
Yes.
And so that's something that is more affiliated with the more serious type of the E. coli. But again, this is all, we're just kind of hearing this in real time as it's coming out. So, just take every precaution that you can to avoid the water source and seek medical help if there's a question.
That's what she just said. Yeah, that's what the doc just said.
We're going to be wrapping up here. We have another minute or two.
I'll catch you with this. Yeah, for sure. And definitely don't hesitate to go to the hospital. I mean, that doesn't sound good. But I'll get to it right now. Bye.
Okay, one last question, Joe, and then we'll wrap up the show.
That was Terry from Santan Valley, and said the skin in her mouth is coming apart, and she has bad bloody diarrhea. And she did eat breakfast at a local. I'm not going to mention any restaurants at a local place this morning, and had water.
Okay.
With that,
yeah,
I would say, see a doc. Bloody diarrhea, I'd be running. I mean,
yeah, absolutely.
What is the mouth thing? Could that be just something different?
It's the mucosa, and it's interesting. And one last kind of thought as we wrap this up, the lining of the intestinal tract, which is what we call the mucosa, lines the entire colon, small intestine, esophagus, and it actually ends up in the mouth. So from mouth, extending all the way down through to the to where we excrete, at the anus and the rectal area, the lining is what we call mucosa, and infection can affect that. And so the fact that she has this sloughing, this effect that she feels in her mouth, is absolutely consistent with probably this E. coli infection, and without a doubt, I would encourage her to go to the closest hospital. Yeah.
Yeah, right away.
Okay. Any other questions or comments?
Just a lot of comments I see, but they're pretty much talking among themselves there, so that works.
Well, Joe, let's just wrap it up. I think this, it was great to have the senator on the phone for the first half hour.
And she just wanted me to extend her apologies, and she said she looks forward to coming back on.
That's great.
Right away. So
actually, she said that she would have loved to have been here in the studio. So I think maybe next time we can maybe fly her out or try to get her over here or something, because I think it would be a great conversation to continue.
Perfect.
With that, let's close the show. We'll see you. Please don't forget, if you're listening out there, check out our Facebook page, DocTalk Radio. There's a lot of stuff on it, and I'd love to hear some of your comments. If you haven't liked us, come on and like us. Despite today's show, even though it was a little confusing, I look forward to further shows.
That's live radio.
It's live. It's fun.
All right. Thank you.
Take care. This concludes DocTalk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.